Hey guys, thank you so much for joining me on WellnessKE. My name is Fatma. Here on WellnessKE, we like to offer women great information and also solutions so that they can be able to have a more holistic approach to learn ways to balance their hormones. And today we're going to talk about painful periods, also known as dysmenorrhea. So keep watching. If you want to learn more about painful periods, why women end up having painful periods, and also ways that you can be able to prevent and manage painful periods, then this video is for you. I want to remind you that you can be able to hit that subscribe button. That way you can know every time we post a new video. Also, don't forget to hit that like button because liking ensures that YouTube shares this video with women like you so that they can learn more about reproductive health. So let's start the video. If you suffer from painful periods, then I have to say this is something that I've gone through personally. I had fibroids and I went through heavy menstrual cycle, and I also had very painful periods. Actually, medication never worked. Also, injections never worked. It got to a place where it was so painful, I would actually pass out from the pain. And that's why I completely understand you if you've clicked on this video and want to find a solution. Today, we're actually going to talk about painful periods, why women end up having them, and ways that we can be able to prevent and manage the condition. But as usual, before we start the conversation, I like to share some words that are going to help you to understand this conversation better. And the first word that I want for you to know about is dysmenorrhea. Dysmenorrhea is basically the scientific term that describes painful periods. It's the scientific term given to a woman going through painful menstrual cycle. And we have two types of dysmenorrhea. You can either have primary dysmenorrhea or secondary dysmenorrhea. Primary dysmenorrhea happens to be a condition whereby a woman goes through painful menstrual cycle, but they actually don't have an underlying pelvic condition. Examples of pelvic conditions include fibroids, PCOS, endometriosis. So basically, if a woman goes through painful menstrual periods and doctors find out that she does not have an underlying pelvic condition, then they classify this as primary dysmenorrhea. Secondary dysmenorrhea, as you might have guessed, happens to be when a woman goes through painful menstrual periods, but she also has an underlying pelvic condition. So a good example is endometriosis. Women that actually suffer from endometriosis tend to have very painful periods. And also, women that suffer from fibroids tend to have painful periods depending on the type of fibroids, the size, and the location. So we have different conditions that could lead to dysmenorrhea. And this is what they call secondary dysmenorrhea. So either way, it's really important for us to understand the term and to understand what it actually means. So the second word that I want you to know about is prostaglandin. Now, prostaglandin sounds like a really big scientific word, but I promise you, the moment you understand its functionalities, you'll know exactly why a woman actually ends up having cramps. So prostaglandin are actually released by a biochemical known as arachidonic acid. And prostaglandin are released and they actually perform several functions. Some of the functions that prostaglandin has include hemorrhage or blood flow, which is really important in the body. Also blood clotting, because the moment you actually have an injury or a cut, what happens is your blood starts flowing and your body naturally is going to ensure that that blood clots so that you don't end up bleeding to death. So prostaglandin actually performs a very important function, which is blood clotting. Another important one is to induce contraction or labor. So when a pregnant woman is ready for delivery, the body naturally has to start contractions, and prostaglandin is responsible for that. Prostaglandin is also very important when it comes to blood vessel constriction and dilation, which in scientific term they just call it vasoconstriction or vasodilation. So in your body, you actually need the right amount of prostaglandins, because if you have an excess, you could have issues. For instance, menstrual cramps. And if you have low amounts of prostaglandin, you can also have issues like stomach ulcers. So you need the perfect balance. And now that we've understood these two terms, I'm going to now get straight into explaining to you why a woman ends up having menstrual cramps. So I'll take you back to basic science. If you can remember what you learned in school, a woman's body actually consists of the reproductive system, and her reproductive system, first and foremost, has the ovaries. The ovaries perform a very important function. This happens mid-cycle each month for every woman. So the ovaries actually produce an egg, and this egg is known as an ovum. This egg is supposed to be fertilized by a male sperm so that, it can go and attach itself on the uterine wall, start forming a zygote, a fetus, and eventually a baby. But what happens every month when this egg is not fertilized by a sperm? Actually, whenever your ovaries secrete this ovum or this egg, naturally your uterus starts preparing itself, thinking that there's going to be a baby there. And how does the uterus prepare itself? It starts thickening its walls so that the moment this fertilized egg starts traveling down the fallopian tubes and into the uterus, it actually wants to create a conducive environment, and also it wants for this fertilized egg to attach itself on the wall so that it doesn't fall off. It can just attach itself, and if the wall is thick enough, it's going to ensure that there is a healthy process of zygote to fetus to baby. But if the egg is not fertilized, it still is going to travel all the way down the fallopian tube and into the uterus. But the uterus is going to realize one thing: this egg is not ready. There's not going to be any baby. So what the uterus is going to do, it's actually going to shed this thickened wall or this conducive environment it had created, expecting a baby. So this shedding of the uterine walls is actually menstruation. So each month your egg is not fertilized, it's still going to travel down the fallopian tube and end up in the uterus. And now the uterus has to actually shed this excess wall it had created as a conducive environment, expecting a baby. Now, remember when we mentioned the prostaglandin and told you that they're actually responsible for different functionalities? Now, during ovulation, when you release this egg, this arachidonic acid is released in every woman during ovulation. And arachidonic acid is actually responsible for the production of prostaglandin. So the moment you go through ovulation and this acid is released, it starts producing prostaglandin. And sometimes it produces in excess. And so when it is produced in excess, what happens is these prostaglandins start actually causing your muscles, your uterine muscles, to contract. And this contraction also causes cramps, which is why you have cramps during your periods. Also, these prostaglandins, remember, as I told you, are responsible for vasoconstriction and vasodilation. Unfortunately, during this time, as the uterine wall keeps shedding and you're having your menstruation, the prostaglandin actually cause these blood vessels to constrict. And when they constrict, that means your vessels are not getting any oxygen in them. And each time they feel squeezed, you actually feel squeezed, and that's how you end up having cramps during your periods. So this is just a basic understanding for you to know actually what happens in your body when you have your menstrual periods. I really believe in information and knowledge, because the moment you understand this, you're going to understand that you're not weird. There's nothing wrong with you. Actually, you need to fix a couple of things, find a balance in your prostaglandin, and also find a way that you can manage these cramps. So let me take you back to the hospital. Basically, when you go into the hospital and you say that you actually have dysmenorrhea or you have painful periods, what happens is the doctor might prescribe some type of medication known as NSAIDs. These are basically just painkillers that are supposed to help you with pain. Basically, these are supposed to inhibit the production of prostaglandin. That's actually what they do. And so they give you this medication so that you can manage the pain. As I mentioned before, when I had fibroids and medication was something I was put on, I go to a place where medication never worked. So unfortunately, some women have actually experienced this. It takes about 3 to 4 hours before the medication kicks in. And also with time, your body ends up giving you such serious cramps that these medications don't work anymore. And also, when you're at the hospital and your doctor finds out that you have dysmenorrhea, they might also give you a hormonal approach. So they'll give you a hormonal pill. And this hormonal pill is really supposed to do something really interesting to the body. Remember when we talked about the ovulation, when the egg actually is produced, and then, arachidonic acid is produced and prostaglandin are produced. The hormonal pill is basically supposed to ensure that you don't go through this process. But I like to think in this way: we don't necessarily have to stop the process. We can actually ensure that the process still happens, but it doesn't become as painful as it normally is. So for those of you who are, going to go and see your doctor, I'm sure they're going to prescribe the medication, but I also want, when you get home, to also try some other ways. And right now I want to actually talk about some of the ways that you can be able to manage painful periods. Women who go through painful periods also experience other signs and symptoms like back pain, lower back pain, also pain in the lower body, especially in the thighs, diarrhea sometimes, also vomiting, nausea, chronic fatigue, also mental health issues. These are some of the things that come with the dysmenorrhea. So it's actually a very serious condition. And there are different methods that you can use naturally so that you can be able to manage your painful periods. The first one is through diet. There are certain foods and certain chemicals in foods that are actually going to help you in managing your painful periods. And we're going to go through these foods. Number one, foods rich in magnesium. Number two, foods rich in iron. Number three, foods rich in calcium. Number four, foods rich in fiber. And lastly, foods rich in vitamin C. So let's talk about how these foods are going to help you in managing painful periods. Well, the foods that I've mentioned are actually going to help you in different ways. For instance, foods rich in magnesium play a very important role because magnesium helps in relaxation of muscles. So it's actually going to help in relaxing your uterine muscles. Foods rich in iron also play a very important role because they're going to increase your red blood count. And when you increase your red blood cells, actually what happens is you're going to have more blood, meaning your uterine contraction during your periods is not going to be so painful. Also, foods rich in vitamin C are very important. Other than boosting your immunity, vitamin C is actually really helpful in ensuring that you absorb enough iron from the iron-rich foods. Actually, you should always pair up your iron-rich foods with vitamin C because vitamin C helps in quicker absorption of iron into the body. Another important one is foods rich in fiber, and I'm talking about good quality source of fiber. Foods rich in fiber actually are going to help you in eradicating muscle spasms and also contractions. And also foods rich in calcium perform the same function. They ensure that you don't have muscle spasms and contractions, which are actually what happens during menstruation. So now that you know these classification of foods, make sure that you involve them in your diet. And if you don't know where to start, please don't hesitate. We actually have our 30-day nutrition plan. You can join many women just like you who are interested in balancing their hormones, maintaining a healthy weight, and also having pain-free cycles. You can actually subscribe to our 30-day nutrition plan. All you have to do is to send us a comment and we'll be able to start you off. Another great way for you to maintain and prevent menstrual cramps is through fitness and exercise. Exercise actually plays a very big role. For instance, every time you exercise, you actually regulate or lower your insulin levels. And insulin happens to be a fat hormone that leads to complications such as PCOS, diabetes, and so many other conditions. Exercise also helps in the increase of SHBG, sex hormone binding globulin. And SHBG is really important in making sure that it binds the excess estrogen that's floating around in your body. Excess estrogen is actually quite dangerous because it can actually lead to painful periods in heavy cycle. It can lead to fibroids, endometriosis, and so many other conditions like breast cancer and estrogen cancers. So we need exercise in order for us to take care of our muscles, to take care of our nerves, and also to balance hormones. These three factors are really important in making sure that you have a pain-free cycle. If you don't know how you can be able to start your fitness journey, don't hesitate to reach out. We actually have a 30-day fitness plan for you so that you can be able to join many women like you who have started their fitness journey. You can actually reach out to us and we can help you in daily exercises, and you can also have rest days of your choice. If you prefer to work out during the week, and you prefer to take your rest days over the weekend, that's quite possible. And also, our fitness plan is time flexible. If you prefer to work out early in the morning or late in the evening, still fine by us, as long as you get the chance to actually work out. Remember, exercise plays a very big role in ensuring that you balance your hormones. And hormones play a very big role in ensuring that you have a pain-free cycle. Something else that's important to mention, using heat, applying heat on your lower abdomen. Remember when we talked about prostaglandin and how they cause the vessels, the blood vessels in the uterus to actually constrict, and they actually squeeze your vessels such that oxygen doesn't pass through. You can do a direct application of heat using a hot water bottle. If you don't have a hot water bottle, you can use any bottle, fill it with hot water, make sure that you cover it with a cloth so that you don't burn yourself. And every time you have your menstrual cycle, place it on your lower abdomen. Whenever you place this bottle on your lower abdomen, it's actually going to help you in circulation, and also because when these vessels are constricted due to prostaglandin, the heat is going to help them in dilation. So these are some of the ways that you can be able to try and improve your condition of dysmenorrhea. So now that you've understood your menstrual cycle and why your body goes through what it goes through, I hope you can be able to apply this knowledge that you've gotten and you can actually start living a healthier life. Remember, any changes you make today will lead to a healthier and happier you tomorrow. If you found this video helpful, please make sure that you hit that like button, because YouTube is going to ensure that this video is shared by many women, or rather to many women, so they can benefit from the information. If you haven't subscribed to the WellnessKE channel, I welcome you to subscribe to the WellnessKE channel, because each week we post a very informative video and you get to learn ways to improve your health. Thank you so much for watching. My name is Fatma. I'll see you guys next time. Bye.